So how does this song make you feel? Pretty sad, right? It's a sad song. What about if I tell you it's more than a sad song? This is the sound of a depressed brain, a brain suffering from depression. What happens in a brain suffering from depression is that both hemispheres have what we call an asymmetry. The neurons connecting electrically on the left and the right hemisphere is creating really a distortion. So the sound, the music of the brain is not harmonic, it's not happy, it's not what we expect. In this brain, in blue, you can see less electrical activity, and in red, more electrical activity. So the left prefrontal cortex is more activated than the right one. So the brain is the most sophisticated, yet the most unknown part of our body. And all of you listening to me, your brain is now connecting by electrical signals, both chemical but also electrical. There are electrical storms happening in your brain all the time. So my co-founder and myself, we've been obsessed for the last 10 years trying to decode the 100 billion neurons in your brain that are connecting electrically. So at Neuroelectrics, we wake up every morning with two passions: science. We adore science. Ramón y Cajal, the father of neuroscience, and Spanish is our reference. So we want to unlock the brain. And my co-founder is a physicist and mathematician. We look at the brain from a physics and math perspective. And we don't want to just learn about the brain. We want to have a social impact. We want to help patients that need us today. So we created Neuroelectrics 10 years ago in beautiful Barcelona. So we are very proud Spanish entrepreneurs. And with our team, we are committed every day to help all of these patients. So 1 out of 5 in this room is going to develop a brain disease, being it depression, Alzheimer's, epilepsy. The biggest pandemic is yet to come, and it's mental health, it's depression. But we are also aging. Let's take Alzheimer's, dementia. Unfortunately, drugs are not helping in many of these diseases. Why? Because the brain is super complex. So all the entrepreneurs in the room, we need an army of innovators, an army of entrepreneurs that are going to help us cure a lot of these diseases with digital health, apps, medical devices, whatever. The future is not going to be only drug. It's going to be a combination of therapies. So what have we been working on all these years, if the clicker will work? So this is the technology that we've been working on. This technology that I'm going to wear, and I think that's the only reason why they invite me to this event, because they just like me to wear the cap. And my mom always says, Anna, do you always have to wear the cap? I say, yes, mom. So this technology that you see is a bunch of electrodes, non-invasive. So these electrodes can do two things. They can record my brain activity, the electrical signals on my brain, but they can do another thing. They can inject little currents into my brain. So we have a read and write non-invasive portable technology that is going to be revolutionizing, the future of healthcare. So let me show you my brain in real time. So this is my brain. This is the electrical activity in my brain. As you can see, some blue areas are less active than others. You can diagnose epilepsy with EEG or electroencephalography. You can diagnose sleep disorders. We think we can get many other diseases. But moreover, we can use any of these 32 electrodes that I'm wearing to inject little currents into the brain. And we can target different areas of the brain, in a network manner. So we can either excite brain activity, injecting currents. Let's say you have Alzheimer's, and your memory is declining. We can inject currents into the brain to excite your neuron activity. Or in the case of epilepsy, your brain is hyperactive. It's creating seizures. So we can bring your excitation down, we can reduce your brain activity so that we prevent seizures from happening. Isn't it beautiful? And let me tell you, we are not that innovative. In the Roman times, there are pictures of Romans with ray fish over their head. They figure out the concept of electricity to deal with pain. Isn't that awesome that Romans already figured out that electricity could help brain diseases? So 7 years ago, I left beautiful Barcelona to, I would say, less beautiful, but also amazing Boston, right? And I think this is also a call for the entrepreneurs in Spain to really scale up, to go to other territories, to get out of this amazing country and go to the poles of innovation like Boston. So we reached out to Boston Children's Hospital, and we started our first clinical trial on epilepsy. 60 million patients suffer from epilepsy in the world, and 1/3 don't respond to medication, meaning these children have seizures, and even if they take medicines, they don't respond. So the alternative is surgery. You open the scalp, you implant an electrode, or you remove the part of the brain that is creating the seizures. So let me tell you what we did in our clinical trial. We took an MRI of a patient, in this case with epilepsy, together with an EEG, and with the neurologist, we defined where the seizures were coming from. So as you can see in this video, in focal epilepsy, we know where the seizures are coming from. So our team, our technology, creates a 3D model of that patient's brain, a replica of your brain, a neurotwin, and then based on your personalized brain, we compute how many electrodes and how many current do we need to inject to your brain to reduce seizures. So pretty sophisticated technology. It's not only about a device injecting currents, it's about understanding what you're doing to the brain and personalizing. So 20 minutes every day, during 10 days, we stimulated these children at Boston Children's, and we show how after 10 days of 20 minutes of stimulation, we reduce seizures almost 50%. Let's think about that. We managed to reduce seizures to half in a non-invasive manner. This is a new therapy that doesn't exist today. And let me tell you, it's made in Spain, scaled up to the US, and recently the FDA declared this as a breakthrough technology, meaning this is a breakthrough treatment for patients in need. So we are very proud to create a new therapy. That's what entrepreneurs do. They change the world, they imagine a future where they can develop something that it didn't exist. And we are now doing 200 patients more in 25 US hospitals, and we aim to become the first company in the world to get approved by the FDA with this innovative portable technology. So our vision for the future is really going home. I think that's the topic of South Summit as well. So the future is going home. We envision a future where patients will be wearing our technology home, and that's why we are also doing a trial on depression fully at home. All these patients that we are stimulating don't go to the hospital, and they receive stimulation at home. So I think that's a sustainable future that we have also discussed at South Summit. And to finalize, I would say that in terms of human evolution, you're going to see more and more neurotech. It's not only that we are developing new therapies, but think about Elon Musk, Peter Thiel, all the Silicon Valley entrepreneurs are getting into neurotech, developing new human-computer interfaces. Human evolution is going to change in ways we cannot even imagine right now. So imagine the interactions. I think in this debate, we are going to conquer the knowledge of the brain, but we are also live our lives very differently. We have to think ourselves about the ethical consequences of neurotech, but I think it's going to be an exciting future for neurotech, and you're going to see more and more companies like mine developing all kinds of neurotech interfaces. And Julio and I are not longer alone. We have a team of more than 70 people throughout the world that are working every day. And I commit my team, my wonderful team, that will be working restlessly until every patient has the right music. And we hope that will be a happy music. This is the way your brain should sound: happy, harmonized, and healthy. Thank you.